Each and every day in this country, Americans are grappling with healthcare premiums that are growing 3 times the rate of wages, and insurance company policies that limit coverage and raise out-of-pocket costs. Thousands are losing their insurance coverage each day. Without real reform, the burdens on America's families and businesses will continue to multiply. We've had a vigorous debate about health insurance reform, and rightly so. This is an issue of vital concern to every American, and I'm glad that so many are engaged. But it also should be an honest debate, not one dominated by willful misrepresentations and outright distortions, spread by the very folks who would benefit the most by keeping things exactly as they are. So today, I want to spend a few minutes debunking some of the more outrageous myths circulating on the internet, on cable TV, and repeated at some town halls across this country. Let's start with the false claim that illegal immigrants will get health insurance under reform. That's not true. Illegal immigrants would not be covered. That idea has never even been on the table. Some are also saying that coverage for abortions would be mandated under reform. Also false. When it comes to the current ban on using tax dollars for abortions, nothing will change under reform. And as every credible person who has looked into it has said, there are no so-called death panels, an offensive notion to me and to the American people. These are phony claims meant to divide us. And we've all heard the charge that reform will somehow bring about a government takeover of healthcare. I know that sounds scary to many folks. It sounds scary to me too. But here's the thing, it's not true. I no sooner want government to get between you and your doctor than I want insurance companies to make arbitrary decisions about what medical care is best for you, as they do today. As I've said from the beginning, under the reform we seek, if you like your doctor, you can keep your doctor. If you like your private health insurance plan, you can keep your plan. Period. Now, the source of a lot of these fears about government-run healthcare is confusion over what's called the public option. This is one idea among many to provide more competition and choice, especially in the many places around the country where just one insurer thoroughly dominates the marketplace. This alternative would have to operate as any other insurer on the basis of the premiums it collects. And let me repeat, it would just be an option. Those who prefer their private insurers would be under no obligation to shift to a public plan.